Good evening. My name is Ayşe Osman. I'm from the Council of Turkish Cypriot Association in United Kingdom. Today we are on a story with regards to COVID-19, CTCA's Through Life Stories. How did COVID affect the Turkish community in United Kingdom? To start off with, we all know coronavirus started in China. According to the records, it actually started in September 2019, but it wasn't known worldwide until late December, early January. It was known worldwide, and the countries all over the world panicked. Nobody knew what to do. As far as everyone knew, there was this big pandemic going around the world. In January, there was only 200 cases outside China in Europe, and Italy was the first country to go into lockdown. Unfortunately, United Kingdom was one of the last countries to decide in the lockdown, and it wasn't until March, second week in March, that the government decided to shut the schools and businesses, and people were asked to stay home and isolate from their families and loved ones. Eventually, during March and June, Turkish Cypriot community lost nearly 400 people to coronavirus, but amongst the Turkish community in United Kingdom, there was somehow over 2,000 deaths. Now, this wasn't just the case for elderly, as it is, said later on. It affected people with health conditions. But it wasn't just the over 60s or 70s. There was I know there was one young child, 13-year-old student who caught the disease. His parents had to call an ambulance and send him to hospital. He survived only 2 weeks in the hospital. Then the boy passed away from his family, all on his own, and even his burial was just on his own. People did suffer tremendously in United Kingdom. The rate of people who got over the coronavirus was 85%. There was a lot of people who survived at home, the disease, and a lot of them had to go to the hospital and obviously had to have doctors help. As I did say, there wasn't enough ammunition in the hospitals. Doctors and nurses were fighting for the case and for themselves and for their families. Today I have 3 of my guests here to speak to us about their experiences. First of all, I would like to introduce Çetin Ramadan to you. Hello, Çetin. Çetin, by the way, Çetin was the CTCA's past chair and is still in the committee. Hello, Çetin, how are you?
Hello, Charlotte. Very good, thank you.
And my next guest is Seniz. Seniz is Çetin's mother-in-law. I've got a whole family here. Hello, Seniz, how are you?
Hello, Ayşe. I'm fine, thank you.
Thank you. Seniz, you're looking well as always.
Thank you very much, Ayşe.
And we have Osman Bey, Seniz's husband, who also had a flu infection during the pandemic. Osman Bey, hello, how are you?
I'm very well, Ayşe, and you're looking well too.
Thank you very much. I needed that compliment.
You're welcome.
Thank you.
We're very worthy.
Thank you. So, Seniz, if I may start with you first. I mean, you did mention that you had flu symptoms before the lockdown.
Just before lockdown, I was with my sister and my friend on the Friday and the Saturday, and my sister had a bit of a cough, nothing more. She thought it was just a tickle in her throat. I was fine. That was the Saturday. By the Monday, I wasn't feeling well I was feeling very weak. I had a temperature. I didn't have a cough. I didn't have major aches and pains at that time. I was just very tired, very lethargic, and had a temperature. They were my symptoms to begin with.
Yes.
But I found as the days went on, the second and third day after the Monday, I was feeling very run down. I'd never developed a cough, but felt nauseous, didn't want to eat for a few days. And that went on for about a week. And after about a week, 8 days, I thought I was recovering. I felt a bit stronger. And I started to get up and do more things because I spent most of the day just laying around.
Yes.
But it came back again. And it went on for about, I would say, 12, 14 days. I was unwell. And it was after the 14th, 15th day that I started to slowly recover.
Yes.
Yeah.
Yes. Did you manage to eat anything in the meanwhile? How was your appetite?
My appetite in the beginning wasn't very good. I didn't want to eat very much. That lasted for about 4 or 5 days.
Yes.
And then my appetite gradually came back. It wasn't huge appetite, but I was okay. I was eating, unlike my husband who stopped eating.
Yes.
Yeah.
Yes. Did you take any medication while you were ill?
No, just paracetamol. Yeah, because at the time we were told that ibuprofen was not to be taken for people with COVID, although that's changed now. At that time we were told it wasn't a good idea. So I was taking paracetamol every 4 hours, and that was it.
Did you panic? Did you feel stressful? How was your feelings at the time?
I wasn't panicking until, again, after it was about the 10th night. I felt breathless. Just for the first time, I felt breathless. I couldn't take deep breath in without coughing, and I felt my lungs weren't getting enough air into them. And that night I did panic, and I phoned my nephew, who's a doctor, and he became anxious and suggested I phone the ambulance, which I did. And it wasn't ambulance actually. It was 111.
Yeah.
And they spoke to me, asked my symptoms, and said they would be sending an ambulance. They said the ambulance would take about 5 hours, but if I became worse, I should again phone.
Yes.
I did become panicky. I did become scared. I didn't want to go to hospital.
No.
I'd heard of a few people that had sadly passed away in hospital that I personally knew, and I was scared to go. As it was, the ambulance didn't turn up, and my symptoms improved, and I just left it. And that's, that was my only time of feeling really scared,
That was scary. I mean, just in case it was more severe case, then obviously I know the hospitals and ambulances were busy, but that wouldn't have helped you in any condition at all.
I reassure myself that if I had become a lot worse, they did say ring back.
Yes.
And I think if I rang back and said I'm in difficulties, I think maybe, I'm hoping, they would have turned up. But because I didn't phone again, and they were quite overwhelmed themselves. So,
Yes. And Osman Bey, what was your symptoms like? I mean, how long after Seniz had taken ill that you felt poorly? Did you have sore throat, aches?
Well, I was nursing Seniz while she was going through the pandemic. But then I came into it later, about 2 weeks later.
No, it's 5, 6 days.
Well,
that you became
the second bout, yes.
Yeah.
I got a severe headache. I wasn't feeling well for about a week, and I thought I've caught it. And it persisted for about a week, but nothing serious. It never affected my lungs or any other part of my body, actually, apart from just feeling weak. But then I started to recover, so I thought, well, I hope this is the coronavirus, and I've beaten it. I've passed it, so I felt a lot better. Soon after that, it came back, and it really came back very severely. I had serious headaches. I could hardly move. I was like a drunk. My stomach was in pain.
Yes.
The good thing was my lungs weren't affected. I couldn't eat. 6 days, 7 days, you said, was it? 6 I thought it was less than that.
No, I think he went 7, 8 days without eating.
Yes.
I mean, very, very little. We had to get him Ensure, they're called, the drinks, which have a bit of
Nourishment.
Yeah.
Yes.
He wasn't eating any solids.
I lost track of the days, actually. I was getting that bad. And at one stage I felt, well, I'd be better off out of it.
Yes.
But anyway, slowly I recovered from it. I did take the Ensure, but very, very difficult to take it. So I couldn't eat anything. I couldn't take anything down. But in the end, I overcame it. And, I'm very thankful for it.
Yes. What kind of medication did you have? You had something from home, or did you?
No, I just had the paracetamol.
Yes,
paracetamol.
That's all.
Yes.
Yeah.
Were you taking any? Are you under any medical condition?
Yes, I am. Yes, high cholesterol.
Yes.
I was continuing to take all the medication I was prescribed.
But nothing serious. Nothing.
I didn't have. No, I've got a heart condition, but I didn't suffer any symptoms of that.
Yes.
It was just a severe headache and terrible pain stomachs and the overheating of the body, and they were very weak over it.
Yes.
And the length of time, of course, that didn't help.
That's what we both found, that to regain your stamina to the level that it was pre-COVID has taken a long time. Although you've recovered and you're eating well and you're moving around, your stamina hasn't come back mine didn't come back for about 3 weeks.
Yes.
And
I haven't regained my sense of smell or taste. Occasionally I taste things.
Yes.
The only thing I can taste really seriously is garlic. Even the slightest thing of garlic, it feels like I've had a mountain of garlic.
It irritates you.
Oh, yes, very much so. That's the only thing that I've noticed about
but
my
before
condition.
That you were okay.
No, with garlic I was fine. I couldn't touch it now.
Yes. What about the headaches? Do you still get headaches?
No headaches. No, back to hopefully back to normal, apart from the eating. The sense of smell and taste.
Yes.
And yes, I'm back to more or less my normal activities.
Did you go and see a doctor afterwards when you felt better, when the lockdown eased off? Did you go and see a doctor? Did you have any tests done?
No, not at all. No. Just got over it, and we were thankful for getting over it, and just try to get on with our lives actually and recover where we left off.
Yes.
And to a great extent, we've done that. So we're very thankful for that.
Yes.
And
I must admit, you're both looking really well.
The sunshine didn't do any harm. That helped rather a lot.
We're lucky we did have good weather actually in the summer.
Lockdown was very nice. It was like a holiday in the garden.
Right.
We were we're fortunate enough to have the garden.
Yes.
I mean, not everybody does, which is very difficult for them. But it was lovely to sit in the sun.
And how did you feel not being able to see your family when you were ill?
They would come to the window and wave at us, you know. And my daughter would come and just drop things off. My sister would come. Chetin would, they would all come and just... and because we had each other, and I recovered and he nursed me and I recovered and nursed him, we were not... We weren't so incapacitated that we couldn't look after ourselves.
Yes.
On top of that, we've had neighbours come along too and say, "Do you need any help?" Obviously, we thanked them and said, "Look, we've got our family, which are quite local.
Yes.
We've got all the help we need."
Been good. I mean, then you see the neighbours every once a week. We used to go out to clap the NHS, and you get to know your neighbours when you hadn't done beforehand.
That's right. Yes.
So that was good. But
although you lived here long years,
you don't interact with them in the way you did at that time.
With my neighbours. I know what it's like.
Over the fence, which is fine. And,
that's right.
But I think it was a time of people coming together and helping. And if anybody was alone and needed help, you looked out to see if they were okay.
Yes.
But the family illnesses were staggered though, which helps.
It was,
we were all very considerate of each other.
That's
Yeah,
right.
Yes.
we waited when he was better than he
We're
got
very
ill.
respectful
Yes.
for each other.
And
And,
what about you, Chetin?
well, yes.
You did look after them. You were telling me, sending me messages
Yeah,
that your in-laws were poorly.
yeah, they were very poorly.
He would say to me, "I just brought soup to them and I left it." You know,
Well,
in
my wife
front
would
of
do it
the door.
mainly, but
Yes.
yeah. But I mean, no, it was, for me personally, my experience, I'm relatively fit. I've got no underlying issues, health
Conditions,
issues. Towards the end of, it was end of March, really. We don't know where we got it from.
No.
We keep blaming my son from his return from university, but
Not
anyway,
necessarily, really.
but it might not have been.
No.
We could have caught it from mum-in-law. And anyway, I was the first to go down in the family.
Yes.
And my symptoms were severe headaches, sinus. You know, your head was going to explode basically.
Yes.
And for me, I just felt it was a bad cold and flu come together. I was out of it for a few days in bed. You couldn't move. And yeah, you don't feel like eating anything. You can just about drink water. You have to keep yourself hydrated. Paracetamol was the only real cure for the moment. But we were told not to take Nurofen or ibuprofen. But I think personally, I did a couple of times because the pain was so.
You couldn't take the pain any longer.
Couldn't take the pain. You know, your head was going to explode.
Did you realize what was happening around you when you were in bed?
On the first day it happened, I was out of it, and
Yes.
thankfully, you know, my wife Aisha was mobile. You know, she was able to, you know, look after me in particular, because shortly after me, my daughter caught it off me.
Yes.
So we were both strapped, you know, in bed for a little while.
Yes.
But it's not until third or fourth day when you regain a little bit of your energy. And you can start taking some liquids in. I mean, throughout this time, no food.
Yes.
But, you know, severe sort of weakness, nausea, loss of smell, the taste thing going. And at the time, the government didn't recognise this as a symptom.
Yes.
And yet we all had it at the same time,
that's right,
this lack of taste and smell.
Yes.
So we thought, this is it. This is it. We're going to ride through the bad time. But
Were you frightened?
I personally wasn't. No, I mean I was frightened for others.
For your family.
Yeah.
Yes.
Yeah, especially. I mean, my parents are in their sort of 80s. They're vulnerable. I was more worried that they could potentially catch it.
Yes.
Just a trip to the supermarket or outside. If they caught this, they wouldn't stand a chance.
Yes. So who did your parents help? Who helped out your parents during the pandemic?
I mean, luckily my sister lives half a mile away from her, and she's still to this day cooking every day for them.
Yes.
And she delivers cooked food, leaves it at their doorstep.
Yes.
And they take it in, and they cook a little bit, but mum is not so active anymore in the kitchen, so, and neither is my dad, so they need that help every day. I have to mention at this point a little plug for Conseil is they done some fantastic food parcels.
Yes, we did. Yes.
And they were very, very generous. All of the contributors, all of the helpers, everyone who was involved in that, very, very, appreciated. I know Mum and Dad, really appreciated it. And
that was great teamwork, actually, where we delivered food to elderly people who were locked away, who couldn't come out.
Excellent, really.
And it was great teamwork.
Yes. Very good idea.
Shame we didn't qualify.
You wouldn't eat it anyway. You didn't eat anything.
So that sort of helped. Otherwise, the neighbours. I think because they live in a nice part of South London, but they're in an apartment and they don't have the luxury of a garden or anything like that. So that was a welcome treat for them.
Yes.
And a little bit of relief for my sister, who's unfortunately still doing this now, right
today.
now. But we relieve her, and we go there. I go there every weekend, and we take what we can down there. And there are tens of thousands, I'd say, of Turkish Cypriots.
That's right.
In our community that are still in this position.
Yes. Is your parents managing to come out slightly to fresh air? Do they go for, I don't know, do they come to the doorway to get some fresh air, or are they at home continuously?
I'm afraid it's a real lockdown for them. My dad, just before the COVID lockdown, he was due to have a treatment. There was an aneurysm from out of his heart, and he was due to have some hospital treatment. Unfortunately, it was cancelled.
Yes.
And this was during April. So they cancelled it, and only recently, in the last 4 weeks ago, he had the operation. Finally, it was emergency. It was a life or death thing.
Yes.
And he's recovering from that now at home, so he can't go anywhere.
Yes, yes.
So it literally is when we go to visit them through the window.
Yes.
We're talking, and his only fresh air is from there.
Yes, yes.
Yeah, so it's tough times for them, and ordinarily they're being Cyprus from March until November.
Yes.
So they miss the outside.
Yes.
But
do they want to go to Cyprus? Do they long for it?
They really do long for it. I mean, my dad's he got bad news last week that the consultant said you need to rest a bit more
before you go. Yes.
So, but they relaxed the rules a little bit in North Cyprus, as you know. It's now 7 days self-isolation. Yes.
Well, apparently people can isolate at their own house.
That's right. Yeah.
Instead of staying in hotels.
Yeah. Correct. Yeah. Yes. So we'll see. We'll see if he recovers fully, then we'll try and get him there. But I think the advice is to anybody who's vulnerable still, whether you're old, young, or whatever.
Yes.
You need to stay protected because it's a real risk. We have lost close ones. We've lost relatives.
We have. Yes.
And some of them have been young. And it's a virus that does exist, and it does kill.
Yes. Well, until a tested vaccination is found, we are treading on dangerous grounds.
Yeah.
I know that we have to cover ourselves when we go out, wear face protection, gloves, and not to go into crowded places.
Yeah.
But it is very scary out there.
It is, yeah.
And when the lockdown eased, people are frightened to use the public transport to go to work.
Well, I haven't been on the public transport.
No, we haven't. No. Yes. No. It is scary.
There's too much unknown.
Yeah.
That's right.
We did manage to get these tests, the retrospective tests done as well. As a family, we all had it done.
Okay.
I know my father-in-law and I, we showed positive that we'd had coronavirus.
We did have coronavirus.
And we showed also that we had antibodies.
Okay. Can you explain to us what antibody is?
Yeah, so basically if you've caught the illness, your body's immune system shows a reaction to the virus. And there is a signal in your body that is effectively what we call an antibody, so that it recognises the virus if it was to come again, and it would attack it. Now, ordinarily with most viruses, that antibody is there for the rest of your life.
Yes.
And so if there is an illness that comes back and forth all the time, it kills it automatically. But with this particular corona strain, it's not known. There isn't enough historical perspective on how long these antibodies last in your body. It ranges from 3 to 6 months up. Nobody really knows because the virus hasn't been around for that long.
That's right.
So until we got this historical perspective on, how long this lasts in our bodies, then that test could be meaningless,
Yes.
really. I know at times it gives us a false sense of security,
Well,
and
it is a false sense of security because you don't know just because you've got the antibodies today.
Yes.
In a week, 2 weeks, or a month's time, whether you'll still have it, and it could end up being like the flu jab, which you have to have every year anyway.
Right.
Well, it mutates. This is what the thing which they found now. I believe that's something which they've accepted is what's happening with coronavirus. There's other corona infections around, and this is the 19th.
Well, there might be few infections around, and obviously it hasn't been proved, so we don't know.
Well, you have to wait for the time for certain things to be, because you've got to see how long the antibodies stay in the body for, and only time will tell that. You can't really hasten that.
Yeah.
Are you frightened in a way? I mean, as we're approaching winter, there's going to be more flus around. How do you feel moving forward? Are you scared?
I am concerned because of my age, because over 70s, also because my husband has a heart condition.
Yes.
I'm concerned that if the corona, spikes again, I don't know if we have any protection against it. That's not been proven. I'm concerned, but there is also a part of me that's reassured that they're doing a lot of research into it, and there's a lot better treatment for it now than there was when it first came out. A lot more people are surviving it than in the first few months of it. But to say that, I mean, I'm not happy to just go anywhere and mix with crowds, and I won't go into public transport. I won't go into enclosed areas with lots of people. So yes, I am I am anxious. I'm not free.
I don't blame you. I mean, I haven't had any symptoms, but I am frightened to go into crowded places. I think everybody is.
Yes.
I mean,
well, the young are okay. They feel they're all right. What the young don't seem to realise is, although even if they catch it, they will probably be okay. It's when they bring it home to the family, to the older generation at home. So this is the concern.
Yes. I mean, my son goes to work, and when he comes home, his shoes are left outside. Straight away, there's a cologne. He washes his hands, and he goes and he does proper wash.
Well,
He has his shower. His clothes is straight away goes into the washing machine. I mean, there's this panic indoors that we didn't have before.
Exactly.
So we have to take precautions.
You do. I mean, my nephew, who works in the hospital, I think he came into the house last week for the first time. That's the first time he came in, and I had to give him a special chair near the window. And he had to have a blanket on it so that I could, when he gets up, that blanket is moved away. So he is so. But then you see, when you've worked on the front line.
Well, he's been on the front line for quite a while, actually.
And seen what he's seen. He's not concerned about himself, he's concerned about us.
Yes, being elderly. Yes. How is he coping being in the front line? Are you all worried about him?
He's not in the front line any longer because he's doing his own research, and he works in labs at the moment because he's doing a PhD. But he was at the peak of it he was in Northwick Hospital.
Seconded to the front line, in actual fact. So he had to give up his studies.
Because there was shortage.
That's right. Of course we were concerned, very concerned. You would be, wouldn't you?
I can imagine what his mother was going through.
Yes.
Oh God, that must have been really bad.
It was. I mean, she's had enough tragedies.
She did have enough tragedies,
and just to it was a very anxious time. Yes.
I mean, I think what you'll see it now. Just general hygiene is key. You mentioned your son. I think a lot of people in their households or going to do daily things, whether it's supermarket, washing your hands, and this face mask as well, which I can't bear.
It's not comfortable. It's very uncomfortable.
Nobody likes them. No,
and I wonder about people flying to Cyprus to be on a plane. Let's say about 6-7 hours.
Yes.
Waiting in Istanbul. So,
but I just wouldn't go. You see, I'm too anxious to get in an aeroplane.
Yeah.
I think, well, you know, why will I do that now? Just leave it. Just don't go.
Yes.
But that's
it doesn't matter if you don't go to Cyprus 1 year or anywhere else in the world.
It doesn't matter if you don't have a holiday this year.
No, it doesn't.
Yeah. But young people are not at the same risk level as we are. And, you know, they will...
Yes.
But the downside of that is it's the young people now that are bringing it back in.
Yes.
So.
Okay, we will have a little break now and then we'll carry on with our discussion in the second part. CTCA's or CONSA's COVID-19 real life stories, we are carrying on from where we left off. Çetin, if I may turn to you now, you did say your wife had the symptoms as well. How is she approaching at the moment? How is she feeling within herself? Is she out of the house? Is she going out? Has she gone back to her normal lifestyle?
Yeah, I think generally we, as a family, we're slowly getting back into more routine things, whether it's work, you know, whether it's going out for something to eat, or even going to get a takeaway, you know, all of those sort of normal things, inverted commas, have changed, I'd say, from what we were doing pre-COVID.
Yes.
But we're slowly, you know, as we've sort of got over the illness, we have this false sense of security, and with regard to Aisha or both our kids who had it, you know, we still approach things with caution. You know, yesterday my daughter had her results for GCSEs, for example. We went out to celebrate.
Well, congratulations.
Thank you very much.
That must have been really good for you, the whole family.
It was, yeah, it was. We're proud of her.
Yes.
But, you know, it was booking a restaurant.
Yes.
And it was going to a local place. But you're socially distanced. You have to wash your hands and you know, with the gel, etc. And, you know, names, details, everything's taken and it's done. And the staff are serving you. They've got masks on.
Yes.
And gloves. And that's not real. That's not. It's almost surreal. You know, it's one of these movies you see on TV. But with Aisha, she had varying degrees of, you know, the illness. We didn't all have the same symptoms.
It's very unusual for you to have COVID-19 and all of you to have different symptoms, isn't it?
Yeah.
This is the way it's worked out.
Yeah.
It's really unusual. I mean, obviously everyone's got different, I don't know, blood, I would say. What is it? What is it that hits the body with COVID-19 that, you know?
It seems to find something weak in your body.
Yes.
Something that is naturally weak in your body. And it has a real good, you know, attack at it.
Yes.
I think it's your personal genetic makeup as well.
Yeah.
Because I have a friend, and she's got lots of after effects from it.
Yes.
You know, she seemed to get over it after 14 days, 15 days, and she felt quite happy that she'd got over it.
Yes.
But now she's having constant.
So it's come back.
It's not that the COVID has come back, but the effects on her body.
Yes.
I think that's the after effects. I mean, I'm feeling some of the after effects of it. Occasionally I get a thick head and, you know, it's difficult to shake off.
Yes.
And, of course, the no taste and smell, that's also a big part of it.
Yes. It's very unusual what people are experiencing.
Yeah, I mean, you know, my son, for instance, he's just had a headache for a couple of days and a slight cough.
Yes.
But that was it. You know, within 3 days, it was all over for him.
Yes.
You know, my wife, you know, Aisha, she was also, you know, in bed for a few days, and I think she had more of sort of nausea, stomach issues, and more of a cough than I did. I really didn't have a cough.
Yes. What about your children's friends? Did any of them have anything?
Well, my son's university friends, they were all, there were 6 people sharing a house.
Yes.
When we went to pick him up when university shut down, we arrived in Bath at the door, ready to pick him up with his belongings, and he said, everyone's ill in the house.
Yeah.
So everyone had it there and then,
right.
and one particular young lady in there was ill for 2 weeks and she couldn't get out of bed. So then we realised, potentially we were bringing, we would bring it home. But my son's, sort of connected friends from secondary school, a number of their families had it. But the youngsters again were skipping it.
Yes.
They were showing either no symptoms or very mild symptoms. Same for my daughter's friends as well, connected family friends. They'd had it.
Yes.
Yeah, and thankfully, they'd all today all gone over it.
They got over it. We do have some friends in BTCA. Subay.
Yes.
He was taken ill. He had to go to hospital.
Yes.
And I know that he was on ventilators for some time, wasn't he?
Yeah, it's Clermont. He's the chair of BTCA.
Yes.
He was in a coma induced coma for 7 weeks, and he was on forced ventilation through his mouth. And I think 4th or 5th week out, they had to take it out from his mouth because it kept on having a reaction. And unfortunately, they had to go through the neck into his lungs, which helped him considerably. And thankfully, he got through it. He got through it, and he was. We speak daily. Even when he was in hospital, I would phone his family every day because they actually didn't. His family didn't have contact with him directly. Obviously, he's in a coma, but they were not.
The hospitals were very busy, and they weren't giving any reports to the families.
No. You'd find a sympathetic doctor, maybe give them their mobile phone number from a family friend, and that's it. That was the only connection, and this is what they done. This was 7 weeks into his coma.
Yes.
His family were basically on tenterhooks for all this time.
It must have been dreadful for them.
It was. Yes. And with SOB, unfortunately, it did attack his nervous system, and he's recuperating now, thankfully. Yes. But it's a slow recovery, and he still needs physiotherapy. But again, it's his family network, his friend network that helped each other morally to support and get through it because. It's an awful illness when you're in intensive care, and there's no one there to support you.
Yeah. I think the level of fitness has to be brought up and encourage people actually do more exercise to improve their level of fitness.
Yeah, and their well-being.
Yes, because that will make a profound difference, I think, as to the severity.
Yes.
If you get the virus, the severity of the virus on your system.
Yeah, I mean that seems to be the general consensus now from the medical experts. But with SOB, his underlying illness is diabetic.
Yes.
And so that was principally
he has lost tremendous weight, hasn't he?
He has.
When I last saw him, when I was sort of meeting.
Yes.
Not face to face, obviously.
Yeah.
In a sort of association meeting, he did look a lot slimmer.
Well, people are being encouraged now to lose weight and to get fit, and obviously it helps fight the virus.
Yes.
But I mean, obviously, for not eating and being, in a hospital or at home in bed all the time, you tend to lose weight anyway.
Yes. Yeah.
And that's the least worry.
Yeah.
Under these circumstances.
But losing weight because you're ill and unable to eat, that's another disadvantage because you're not getting any nutrition.
That's right.
So,
Well, I lost 8 kilos and I'm thankful that I did actually, and I'm maintaining it.
Yes.
I've lost it and I'm going to keep it off.
Yes, of course.
Yeah, I suppose the upside is, you know, those who hadn't become ill and, you know, they're looking for a pastime or whatever, they're going out for long walks.
Yes.
The garden looks fantastic, you know, because
Yes.
you just don't stop digging.
Yes.
So, you know, it's brought the community together.
It brought the community together. I mean, initially we had the first Ramazan Bayramı, and that was heartbreaking because people couldn't get
go to your
together with their families,
Yeah.
and everyone stayed at home. That was very sad times actually for all of us.
Yeah.
And we longed for our families to be together with everyone. That was very touching actually for everyone. And it did brought the community a lot closer. And we're lucky that we had the TVs and social media
Very.
at the same time.
Yeah.
Because there was nothing else to do.
No, I mean, everyone's rediscovering, you know,
Zoom
and Teams and FaceTime. I mean, you know, my parents are in their 80s, as I mentioned before, and we've managed to get an iPhone to them. And I've just about got my parents, you know, trained to push the right button.
Yes.
So it opens up, and then all of a sudden, you can see us on the screen. But we've moved to an iPad now, and we can see more of their faces as opposed to the ceiling. But it's quite comical.
It
really,
is comical.
But
it is sad, but it is nice to see them face to face.
Yeah, that's right.
Yes.
Because I know with my parents, I created a Facebook page for my mum and dad. All of a sudden, they're getting calls from Australia,
fantastic.
all over the world because they
are requested. She requested me to be her friend. I was so surprised.
She's probably pushed the wrong button, but
so we're friends now on Facebook.
There you go. I mean, but it's amazing how, you know, in a completely sort of not planned fashion, we've moved into an area where we're reconnected with family members.
Our lives will never go back to normal now. We have to move on with we have to learn how to live with it.
Yeah.
I think this is a new norm now.
New life, new lifestyle.
I think people will be a lot more wary about their personal hygiene.
They will be.
Because before, I think all of us would come home from outside without thinking, open the fridge, take something. You won't do that now, you because you don't know what you've touched.
Yes.
So the first thing you automatically do when you walk in now is clean your hands.
Well, I don't think I've never washed my hands as much as I did during the lockdown.
Yeah.
I mean, from time to time I had to go out shopping.
Yes.
And touching your front door keys, your car keys.
You have to disinfect everything.
In the supermarket.
Yeah, it's all.
It hasn't been easy, and coming home is worse.
Yes,
you know, because you have to unload and start
wiping everything down. Yes, I've started to sort of ease off a little bit on that now.
Okay,
just a little bit, but
Yes. And Seniz, what are you doing in the meanwhile? I mean, have you started something new during the lockdown when life eased off and you're managing to go out?
Well, in the lockdown or
after
lockdown?
Eased off.
Well, I haven't started too much yet. I wanted to. I belonged to a yoga class which had to stop. She's now messaged to say that we could go back to a class, but they'd only be allowing 6 of us.
Okay.
But they're going to do it online, so I might do that online. And I've also continued with my choir, which is, you know, quite fun.
Yes.
And I've seen a couple of friends now. I've gone out and met a couple of friends, and, you know, we've been to a restaurant and sat a net, socially distanced with that. But as far as doing any more, not a lot more. I'm still very cautious about how much I'm, you know, exposing myself, really.
It's nice in a way because during the lockdown we stayed at home, not bothering to dress up.
That's right.
Not bothering about anything about ourselves.
Well,
it's got to a stage where, well, you want to do something for yourself.
Yeah, yes.
But
the first few weeks of lockdown, I think the first week of lockdown was very frustrating.
Yes.
And then you sort of, you know, grew into it.
Yes.
And then you started to enjoy those times of just being at home and having all the time you wanted to do what you wanted and nobody was going to come and disturb you and you weren't going to go anywhere. But after a few weeks, the novelty of that also wore off, and you got used. You thought, we've had enough now, and we want to start getting out. But the normality of a life as it was before COVID has not come back, and I don't think that will ever be our normality again. To be quite honest, I think we will be living slightly differently.
And yes, Mama, you're lucky you've got the garden. Your garden looks beautiful.
I'm spending a lot more time in there.
Yeah, you're in the garden all the time.
Not quite all the time, but quite a long time,
Yes.
Well,
I mean, we're lucky in a way because we did have really good weather since March.
Oh, yes, that's a big plus.
Unusually hot weather, yes, So it has been lovely, yes.
I've got some tomatoes out there for you. Yeah.
Oh, great. Thank you very much. I'm growing vegetables as well.
Yeah, the grapes are not ready yet.
Yes.
We had figs. We've had figs as well.
You had figs as well?
Yes.
Yeah, unbelievable.
Well, the birds have more than we do.
Yes. Do you do any gardening?
Yeah, I take lessons from my father-in-law.
Now we're in competition.
I see.
The back of my garden, huge vegetable patch, and we've tried the same sort of seeds from tomato, and it's a competition.
I see. So who's got more tomatoes?
Let's keep this at tomato level and nothing else. But no, my father-in-law's tomatoes are much bigger than mine.
Okay, so we must speak through them.
I think too.
But the difference is Çetin doesn't have a greenhouse.
Yeah.
Okay.
But Osman does.
Okay.
So there's an advantage there when you've got a greenhouse.
Huge advantage.
You can. We had some lovely cucumbers.
It's amazing what you can grow, honestly.
Isn't it?
Yeah, I'm sure there's lots and lots of people that are going to take it up again.
I think everyone's done it. I think people went to greenhouses or to garden centres during the lockdown, and they've been spending all their times in the garden, cooking indoors because there was nothing else to do.
No.
But the garden has been, quite good actually.
Well, with the weather we've had, it's just been, an ideal opportunity to spend time in the garden.
Yes. And also people have been decorating indoors, painting as well.
Yes.
You haven't done anything like that.
Not this time, no.
Çetin has.
I have, I've been busy, especially on the outside. That's endless anyway, as we know.
That's right. It's an ongoing thing,
It is,
yeah.
Yes. But no, it's. I personally think that these things are with us to stay now. I hope so anyway, and especially with getting outdoors, having fresh air.
Yes.
The walks, you see lots of people.
People are walking together first thing in the morning or in the evening.
Yes. And I think it's great. And I have to be honest with you, because our office is a shared office. We're not too far from where we live, but I was on my bike every day.
Yes.
Just left the car. I mean, there's a lot more traffic now because we've gone back to a bit more normality. But in the early days of lockdown, empty
pavements.
And did you smell the difference in the air?
I suppose. I don't know. I kept myself busy in the garden as well.
Yeah.
I love gardening anyway. I planted my own peppers from seeds, and I've been counting how many flowers I had and how many peppers grew out of it. It has been good, I must admit, and I loved being at home. I still enjoy it.
Well, a lot of people are moving to working from home, especially for their office employees.
I don't think these people will go back to work actually for some time.
No.
I think the novelty eventually will wear down, because I spent a lot of time working at home. I think it was about 10 years, wasn't it?
Yes.
So I got on Çeniz's nerves and then moved into the office.
He's trying to blame me. He just wanted to get out.
Yeah.
He missed his office. Well, okay, you lovely people. It's been really nice sharing your experiences with us. And I'm so glad that you're over from this awful virus. You're back to your normal lifestyles. I hope you will look after yourselves forever. We have to say thank you for the time being. Thank you for being with us. And is there anything you would like to add, Çetin?
I'll just say thank you very much for giving us the opportunity to share our experiences anyway. But just to say to people generally that not to be naive. You know, this is a real virus. It's threatening. It's life-threatening virus. To keep the basic things going, keeping clean, hygiene in, out of the house, and protect those ones that are vulnerable.
Yes. Yeah. Thank you, Çetin.
Thank you, Shannon.
And Seniz?
Just thank you very much for giving us this opportunity. It's lovely to talk to you. I will only second what Çetin said, because it's you know, we do have to be, we have to look at life differently. We have to be more careful, and we have to look at all aspects and everybody and protect.
Yes, thank you. Osman Bey?
Well, I won't repeat what they've said, because the feelings are the same. So, and thank you for coming. We haven't seen you for a while.
Thank you very much. Well, we will continue with the second part of our talk discussion on COVID-19. And thank you again. We'll carry on in a minute.
Further to CTCA's COVID-19 True Love Stories, I have pleasure in introducing general practitioner from London, Dr. Bengi Beyzade. Hello, doctor. How are you?
Hi. Good evening. I'm fine. How are you?
I'm very well, thank you. Doctor, can I ask you to introduce yourself to us, please?
So my name is Bengi Beyzade. I'm a GP, and I work in London.
And how long have you been in the practice?
I've been at my current practice for 17 years now.
Yes. Dr. Bengi, if I may ask you, during the lockdown, you must have had endless telephone calls from your patients. How difficult has it been for you?
Well, it has been difficult. Obviously, we're all learning together about this disease, and no one really knows how to manage it correctly. We were dependent on advice from the government and looking at the news from other countries and how they were managing it too. I mean, obviously, we were all scared that the NHS would become overwhelmed. And then at the beginning of it, I had COVID as well, so I had to have time off too. So when I came back to work, it was all a bit crazy. And I was talking to a colleague today, and I was saying it's like trying to be a doctor with one hand tied behind your back, because you don't have all the tools you could normally use. You weren't seeing the patients physically. You couldn't examine them, and everyone was scared.
Yes. Doctor, did you have enough protection for yourselves and your colleagues or your, receptionist?
So at the beginning, we didn't really know what protection was needed, and we were wondering whether we needed to have suits with very specialist masks, and we were scared about how the infection was transmitted. So we wanted a certain degree of PPE, personal protection equipment, and it wasn't available to us at all. In fact, it probably took a good 2 to 3 weeks to get any sort of protection.
Yes, I mean, it must have been very scary for you as well, not knowing what to expect. Did you practice during initially in the beginning from your surgery?
So we were practicing, and we saw a few early cases before lockdown fully happened. So there were patients with respiratory symptoms which were suspected COVID, and there was no facility for testing them, and the hospitals were desperate for us not to send patients in as well. So we were carrying these patients ourselves, not knowing how to treat it and not having any option of where to send them either. So we were stuck looking after them and not knowing how to look after them.
Yes. Doctor, if I may ask you, obviously, it has been very, strange and frightening. What age group reach out to you mostly?
I mean, it's all age groups. One group we stopped seeing at all was children, really, because they were kept away, and I think because they were locked down, they weren't getting any infections at all. But anyone from 20 to 80 would be in contact with us. We were asked to look after the sick and elderly particularly, so we would proactively ring up our list of vulnerable patients just to make sure they were all right, and reminding them that we were open for business as well. So on top of the ones who'd ring us, we'd be actively making sure the vulnerable were okay at home.
They didn't attempt to come to the surgery, did they?
Oh no. People wanted to keep away because they thought if they turned up here, they'd catch COVID. So everyone was keeping clear.
Doctor, if I may ask you, in your opinion, obviously, as a British, Asian and minority ethnic society and the Turkish community, why are we suffering more with this pandemic? Do you have any idea?
Well, I don't know for sure. I'd have to have an educated guess, in all honesty. I'd say the Turkish Cypriot community and Turkish community in Britain aren't the wealthiest. They may be more at risk of overcrowding. They may have higher incidence of chronic diseases as well. So and what we know for sure is those who've really suffered with coronavirus are those with pre-existing conditions. So, I mean, if I was to give an opinion as to why the Turkish and Turkish Cypriot community have suffered disproportionately in comparison to the white British population, I'd say it would be those issues.
Yeah. Do you have all the test equipment available in the surgery now for people to come and have a test to find out if they did have coronavirus?
Yes, that was rolled out maybe a month and a half ago, and initially it was for staff members to have the coronavirus antibody test, but now we're free to request that test on whoever we feel it appropriate for.
Yes. Obviously, we're approaching the winter months, and there's going to be all different kinds of flus around. It will be more dangerous, I presume, this year. What kind of vaccination do you recommend for people to take?
So as with every year, the influenza vaccine is available, and that's for everyone from the age of 65 and people with pre-existing conditions like asthma and diabetes and heart disease, or if they've had a transplant, if they're pregnant. School children up to the age of 11 will get it now as well. So all those groups should definitely have it this year, and there's definitely enough stocks for that. I know that the government is pushing for all over 50s to get it as well, but the rollout program for that is not clear yet. We don't know if there's going to be enough supply and at what point GPs will be given access to those stocks. Okay.
I mean, usually it starts about mid-September, October, but we don't know when it's starting this year.
I mean, my practice got our first supply this week, and we sent our first invitations out to the patients over 65 today. So we've got our clinics in place from next week, and I should think a number of practices should be setting up their clinics from next week or so.
Doctor, the second phase of COVID-19, obviously the first phase, people who had it, how likely are they to suffer with it the second time round? Do you have any idea?
Again, I'd be guessing. I know there's been one case named in China of someone who's had it before, who caught it again and caught it more mildly the second time, but that's one case. I need to see a stronger body of evidence to see if you are at risk of getting it again. The first wave of coronavirus took out a very vulnerable group, with 40% of those who died coming from care homes. So, I mean, it is picking on the most vulnerable in society, and there are less of those people around now. And I think those who have survived, like my parents, are going to be ultra cautious not to risk catching it during the winter. Yes.
Doctor, I believe your family suffered. You had some losses in your family as well. How difficult has it been for you?
It's been very difficult. I mean, my wife lost her mum. My brother lost his mother-in-law. I mean, and then we've had to continue doing our job at the same time. I know my wife still is she's a practicing nurse at University College Hospital London, and she really hasn't been given the time or the space to bereave properly because she has a job to do.
When you mentioned your brother's mother-in-law, that was a very well-known friend of ours, Samime Bilginer, Dr. Tahsin Bilginer's wife. Yeah, that was tremendous loss, you know, amongst the Turkish Cypriots. And it has been very difficult because we lost a lot of elderly. And the unusual thing was Samime Hanım lost her brother. Then we lost Samime Hanım, like a brother and sister within a day apart from one another. And it has been a very touching story. As I said, we're approaching the winter months with COVID-19. The schools have opened today. Children are going to school. There's going to be a lot of sufferers, I take it. And, you know, according to the news, flus will come in all different kinds this year. Different kind of flu attempts or attacks on people. What do you suggest that we do to take care of ourselves?
I mean, I'd think about the safe distancing. We saw that flu stopped happening in the UK a month or two early because people had locked down from coronavirus. Also, infections affecting children, they stopped happening from March onwards as well because everyone was locked down. There is a way to prevent transmission of this infection, and that is to keep a safe distance and to look after yourself, and more importantly, look after those who are vulnerable, who are close to you. So, so think about your mother, your father, your uncle, your grandmother, and make sure they're safe.
Yes. Well, Dr. Bengi, thank you very much for taking time to be with us. Is there anything else you would like to add to this discussions that we had tonight?
I mean, I know that there's been a lack of trust of the government based on them changing their mind about many things. I think one has to look more widely about how the rest of the world has managed this condition and how one has to protect oneself and protect one's family. In order to stay safe, you do need to maintain self-distancing. It isn't an imaginary disease that has killed people that don't matter because they were going to die anyway. It can kill your mother, it can kill your brother, and it has done already throughout the UK. Yes. So please stay vigilant.
Okay, Dr. Bengi, thank you very much. It's been nice talking to you. Keep well. Thank you.
I would like to thank Dr. Bengi Beyzade for his exclusive interview with us. He must have had a very difficult time in his family, losing his mother-in-law during the lockdown. My condolences to the family as they grieved during the lockdown at home, all on their own. They must have had very difficult times. COVID-19 is a very infectious disease. Please look after yourselves, especially the elderly. I would like to thank all my participants, Duygu Tamaç, Kanal T, CTCA family, and thank you for watching our true life stories. Please take care of yourselves. Do wear your protection covers when you're in crowded places. Keep well.